Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Frontal lobe syndrome. So frontal lobe syndrome, the frontal lobe is the largest lobe in the human brain. It is the largest, and this syndrome leads to the disorders of the cognition as well as the mood. Then comes the motivation as well as the behavioral control. So there are three important syndromes associated with this. So the first one being the orbitofrontal syndrome. So what is this orbitofrontal syndrome? The orbitofrontal syndrome, it results from a bilateral lesion. So there's a bilateral lesion of the orbitofrontal cortex, and the medial surface of the frontal lobe. Next is it's a disorder of the orbitofrontal cortex. And also there is a disinhibited behavior, there is impulsiveness, then comes a limited insight, then the poor judgment, and the treatment wise orbitofrontal syndrome, there is administration of the SSRI. Next, moving on to the dorsolateral syndrome. So under the dorsolateral syndrome, it is a frontal convexity syndrome. This is a disorder of the dorsolateral prefrontal cortex. So dorsolateral prefrontal cortex, and there is a deficit of the recall of previously learned information. So the deficit of the recall of previously learned information, and there is impaired planning. Next comes the impaired attention. The attention is affected, as well as the presence of the concentration is also affected. The depression may be seen as well. Next, moving on to the medial frontal syndrome. So here in medial frontal syndrome, there is presence of the apathy. That is a lesion. It involves anterior cingulate gyrus. The lesion involves the anterior cingulate gyrus. Then comes there is poor motivation. There is decreased interest. Poor motivation. There is decrease in the interest, and there is a decrease in the emotional concern. There is decrease in emotional concern. To learn and grow daily like this, please do subscribe.